If this attack becomes severe, then the patient may lose consciousness and the whole body may start jerking vigorously. It would then be called a major epileptic fit. Less commonly, these major fits may continue for hours. 90% of the time, both types of epileptic fits end within 1 to 2 minutes. Because of this, people sometimes get a wrong impression that it was their intervention that aborted the attack, which is not the case. How and how often fits occur? Epileptic patients tend to have repeated epileptic fits. The frequency may vary. One person may have an attack every month. Another will have it once in every 3 months. While a third person may have an attack every week. Some people may have an epileptic fit as infrequently as 1 in 6 months, or even once a year. Some epileptics may have fits only at night, while others may have more attacks early in the morning. This variation is because of different types of underlying epilepsy. At times, patients do not have typical whole-body jerking. Rather, they just have a sudden brief jerk, like a startle. This is also one of the minor seizure types. In the majority of the patients, an attack may occur suddenly on top of normal ongoing activity, but 25 to 30% of the patient may get a feeling that the attack is about to occur. This feeling is called an aura. Such a patient would him or herself tell you that they experience a peculiar phenomenon before a seizure starts. Some patients may even take protective action, like sitting on the floor, or get away from a dangerous place where they experience an aura. 70% of the people will not get a warning, and the attack occurs suddenly. Epileptic fits are usually of a short duration. Even before you can try any remedial action, a fit usually ends on its own. Another peculiar thing is that 99% of the people get back to their normal self within 15 to 30 minutes after a seizure, as if nothing happened, or at least no permanent damage has occurred to the brain. So, this is a noticeable aspect of epilepsy, that in case of a seizure, the brain loses its functionality during the event, and then gets back to the level as if it was before the fit. If a person has some or all of these problems, he may be suspected as having epilepsy. For a formal diagnosis, a physician requires training. Neurologists are expert in dealing with this disease. Sometimes, a test is done to make the diagnosis of epilepsy, which is called as EEG. During EEG, electrodes are applied on the scalp, which then record the brain's electrical activity. An EEG may show abnormality in the brainwaves, and it is then helpful in diagnosing epilepsy, or its subtype in a patient.